Good afternoon, December 18, 2025. We are broadcasting live spine surgery here from Deuk Spine Institute. Our patient travels here from New York, New Jersey, originally from Harlem, and now living and working up there with his lovely wife. I met both of them. They've come to Deuk Spine Institute because in New York, they're only offering him fusions for his spine. He doesn't want a fusion. He knows fusions have all kinds of problems, complications, pain and suffering afterwards, adjacent segment disease, muscle damage, destroyed ligaments and tendons out of your spine, all kinds of stuff. So he said, I'm going to Deuk Spine Institute. When he told his doctors in New York that, they said, don't go to Florida. You don't need to. We've got the best surgery here, but you need a fusion. But again, he said, I'm not getting a fusion done. And he doesn't need one. So we recommended 3 discs to be fixed, but today we're going to fix 2. He wants to fix 2. I think the 2 we're fixing are the most painful. All right, you ready, Dr. B?
Yes, I am.
Now, what is this scar here? You see that? It almost looks like a scar.
Yes, we do.
All right, let's get started. A little numbing medicine. What happened? Where's the other one? What's wrong with the fiber?
No, I need a new one. I need one.
We don't have one?
Yeah.
Am I just too fast for you guys?
Yes. Yeah.
L3-4, L4-5, left side, we all agree? Well, let's get started. Let's hope his back is not as deep as our last patient's back. Her back was so deep. Remember that? I thought the needle was going to hit the floor. Now, Henry, back pain. Most common reason people go to the doctor in the world. Over 1 billion people worldwide with chronic back pain. Henry, why do people get back pain? I know we've got a nice video to explain the 30 causes of back pain. Would you mind sharing that with our audience at this time?
Of course.
I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majin. Thanks for joining us. Welcome back. You've just seen the 30 different causes of back pain, and the most common cause is the disc. That's what's causing this gentleman's pain. He has several discs causing pain, I think 3 of them, but he's fixing 2 today. These are the 2 most painful discs. Of all the discs in the lower back that cause pain, there are 5 of them. The most common is L4-5, followed by L5-S1. In his case, his L5-S1 disc is perfect. There's nothing wrong with it. We looked at it on the MRI. It's not damaged in any way. It looks just totally normal. So I knew L5-S1 was not causing his pain because the disc was 100% normal. On the other hand, his pain was a little higher at L4-5, and it was consistent with the injuries that we were seeing with the L4-5 disc on the MRI scan. And he also had higher up L3-4 and L2-3. But most of the pain was 4-5 and 3-4, not 2-3. So he chose not to do 2-3. He's just going to get 2 discs fixed. We are currently working on number 4-5. We did a discogram. You could see the blue dye. And the discogram dye, as I was talking to the patient in pre-op, he already knows. He's watched so many of these surgeries. He knows pretty much everything about the surgery. We were chatting about the dye in the pre-op area, and he knows that the dye actually binds to herniation that is degenerated, but it has to be degenerated. So if you have a herniation that happens today, brand new, first time in your life, in your lower back, and I put the dye in your disc, it will not bind to the herniation. It will stay white. The herniation will stay white, the dye will leak out and not bind. It will not be a blue color, it will be a white color, indicating that the dye has not bound. Dye will only bind to a herniation that is degenerated, meaning it's been there for a while and the inflammatory system has been tearing it up, trying to get rid of it. So when you see the blue dye, which we're seeing right now in his disc, it's an indication that this problem has been going on for at least a few months, It's not acute. Any questions?
At this moment, no current questions.
All right. Now, what I can tell you is that he does heavy lifting for a job. I told him he's got to minimize the amount of heavy lifting he's doing when he gets back home to New York. And he needs to really give his back a chance to heal up. The problem if you go back to heavy lifting is he's a bodybuilder. He's built like a pro football player. The problem is you can re-herniate and get another herniation. And then he has to come back and get another surgery. Now, the last patient we just did exactly that. He actually already had the Deuk laser disc repair a year ago, but he went to the gym and was doing some exercises with leg press on that leg press machine. And then he just blew out his disc again. So he had to come back and get a second surgery. His second blowout was worse than the first. So please, 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 don't do too much after surgery. Let your body heal, let the disc heal. It takes 9 months to a year. To be safe, you do it a year. Just wait a year before you do anything heavy. All right, questions?
At this moment, no current questions.
So here's what I'm seeing. We're inside the tear at L4-5. I'm seeing not just herniation, which is blue, but it's mixed in with pink, which is inflammatory tissue, meaning that this has been going on for a while. He's got inflammation in the tear, and that's where the pain is coming from, is that inflammation, the pink stuff. The herniation itself does not cause back pain. As a matter of fact, spinal stenosis does not cause back pain. Narrowing of the spinal canal, foraminal narrowing, does not cause back pain. The only thing that causes back pain is the annular tear inflammation for disc, and if it's facet joints causing your back pain, well then it's inflammation within the facet capsule. These two causes of chronic back pain, as you saw in the video, the two most common causes of chronic back pain. Facet and disc. Disc and facet, in that order. Both of them are totally fixable with surgery here at Deuk Spine. But you're going to have to travel. If he had a fusion done, the fusion might work. Depends on who does it and what they do. But every doctor does fusion a little bit differently. That is a 100% true statement. Every doctor does fusion differently. That is a 100% true statement. So it's important who you choose to do your fusion surgery. Most surgeons, in my opinion, do a bad job with fusion. They don't choose the right levels. They don't use the right technique. They don't properly realign the spine to give the patient the best curvature in that area that they're operating on. Many surgeons leave the spine straight instead of curved. Well, the spine is not supposed to be straight. It's supposed to be curved. So if you're fusing somebody's spine straight when it's supposed to be curved, you're going to create problems for that patient down the road. The most common problem, in my opinion, is adjacent segment disease. Adjacent segment disease is a function of bad surgery. Now, other doctors will disagree with me. They'll say you're wrong, but they just don't understand adjacent segment disease. Adjacent segment disease comes about because of undertreating patients' disc problems or segmental issues, their segmental instability. Adjacent segment disease also comes about because of poor correction of alignment. Very common problem during surgery. If the surgeon does not correct the alignment properly, the spine will be out of alignment. The patient will then wear out the joints above and below. Doctors don't want to accept responsibility for their actions in contributing to adjacent segment disease. So what they end up doing is they blame it on the patient or blame it on the process. They'll say, oh yeah, fusions and artificial discs both cause adjacent segment disease. It's true, they do, but it's not the surgery, the fusion that causes it, it's the surgeon. How do I know? Because I've done 1,000 fusions on people's backs in my career, 1,000. And my adjacent segment disease rate is 2%. Everybody else has a much higher rate. So why is there so much variation in adjacent segment disease rate if it has to do with the act of fusion? I mean, we're all fusing, so why would the rate be so different? And that is a truism. The rate is different for different doctors. Every surgeon has a different rate of adjacent segment disease. There is no one universally accepted rate of adjacent segment disease after spinal fusion. And the reason, again, is because of the surgery that's being done. Most surgeons, in my opinion, undertreat. They only treat one disc when it should be two, or they treat two when it should be three. I've done fusions of one disc all the way up to 4 in the lower back. I've never had to do more than 4. I've done 1,000, far more than most surgeons. 1,000 patients, that is, not 1,000 fusions. If you count all the discs that I've fused, I've done about 3,000 discs in the lower back, another 3,000 in the neck. Come on, guys, what's up? And from the back of the neck, I've done 500. And when I do the 500, I'm fusing 7 levels. So it's 7 times 500, or it's another 3,000. I've done about 10,000 disc fusions of segments. Okay, 10,000 in my career. That's a lot of fusion. I don't think there are many surgeons that have done as much. Now, in those 10,000 fused discs or fused segments in the spine, I can tell you that my patients had only a 2% adjacent segment disease rate. And I even think I published that. It's been peer reviewed and published, my data. If you look up my name, you'll see it. What am I getting at? Why am I talking about adjacent segment disease? Because that's one of the problems with spinal fusion, one of the problems with artificial disc. They both cause adjacent segment disease. Deuk laser disc repair, I've never seen a single case of adjacent segment disease until today. We had a patient who came back, and she was our first surgery of the day. She had fusion at L4-5. Oh, we're popped out. So we're out of the disc. There it is. We're just outside the disc. That's pretty cool. There's the hole right there. You guys see it?
Yes, we can.
So we're done. We went in with the laser. We cleaned out the herniation, and that thing will seal up. It's about a 1.5 millimeters wide. Okay, you can see the fat outside the disc and the foramen. Pretty cool stuff, huh? So that's one disc down. No more herniation there. Moving on to the next. How come our suction is so weak, guys? It looks better to me now. What was the problem? I'm not going to flip out. We need ratings? Luis! You're too funny, man. You're too funny. I said I'm not going to flip out. Luis said we need more ratings. We need higher ratings. He's right. We need more ratings. All right. Done with one. Done with one. On to 2. See, it's a piece of cake, Dr. Berndes. You are all worried. We're good. Of course, we have to always be vigilant. That's part of our job. We're not just looking after ourselves, we're looking after a patient, right? This patient's life is in our hands. And I take that very seriously, more serious than anything else. All right, coming out with my needle. Any questions, Henry?
At this moment, no current questions.
Henry, what's going on?
I don't
you
know.
got to get the ratings up,
I know,
buddy.
I know. Everybody was asked their questions earlier. All great questions, by the way.
Do we have any viewers?
We do. Yes, we do. They're just admiring us.
Just chilling?
Just chilling, observing.
Just their mouths are too full of popcorn and Diet Coke to
Exactly.
ask a question. Fine. All right. Moving into the next disc. This is going to be the L3-4, the second disc we want to fix for this gentleman. From New York, from Harlem. Harlem. All right, how many of you have all seen the movie Coming to America? Isn't that right?
I have.
Oh, wait, there's another one, Harlem Nights, wasn't there? Harlem Nights, that was a good movie. Hold on. Let me see. Yeah, I think we're ready. Yes. Yeah. Eddie Murphy, Arsenio Hall. I hope everyone's watched those movies.
I have heard of it so many times, have not watched it
No,
yet.
Henry.
I know.
Henry, shame on you.
I know Eddie Murphy wrote and directed
Wait, you haven't watched Harlem Nights, or you haven't watched Coming to America?
No. I've seen Coming to America. I said I saw that, but
Harlem Nights is good. Very good movie. Another one of my favorites is a movie called I'm Gonna Get You, Sucker. You guys haven't seen that?
I think I've seen that.
I'm Gonna Get You, Sucker.
I think I actually saw that like in film school, like in class.
One of the funniest damn movies ever. I'm Gonna Get You, Sucker. This is an 80s classic comedy. You will bust your gut watching this movie. Nikki, you would love it. I'm Gonna Get You, Sucker. I love that movie. I hope you all watch it. It's freaking hilarious. I think it's Damon Wayans is in that movie.
Damon Wayans is directed by his brother Keenan
Yeah,
Ivory.
Damon Wayans is in. I mean, he's got an all-star cast.
Yeah.
Very freaking funny movie. Very, very, very funny. One of my favorites. Comedies. I'm Gonna Get You, Sucker. Hold on. But I don't think it's as good as Coming to America.
Yeah, that movie was hilarious.
Oh, yeah. Sexual Chocolate. Please welcome on stage Sexual Chocolate. That was Coming to America, right?
I think so, yeah.
Or was that I'm Gonna Get You, Sucker? I don't remember.
That's what I'm trying to remember. I haven't seen Coming to America in a couple of years.
I think Sexual Chocolate was in Coming to America. McDowell's. Our buns don't have seeds. It's too funny.
Yeah, no, it was Coming to America.
Sexual Chocolate Coming to America?
Yeah, Randy Watson and Sexual Chocolate.
Was that Randy Watson?
Yeah.
I thought that was Murphy, no?
No, I mean it was, but it was just at the end.
Oh, right.
Yeah.
He played several characters in that movie.
Yeah, he did.
Eddie Murphy played like 3 different characters.
He's a great
Right?
character actor.
Oh, man. That's a big one. We got it. Oh, yeah, it's big. Here comes the great white nothing. I thought that was going to be a great white shark that I pulled out, but... Well, what we're doing, folks, we're removing pieces of herniation, and this thing is breaking up into pieces. I was hoping to get one big fish coming out, but It's just coming out in pieces. That said, I don't care if it comes out in 100 pieces. I'm going to get it all. Right? It'd be nice if it came out as one big piece, but we're not that lucky. The last patient we did, man, we got some big pieces out. All right, any questions?
At this moment, no current questions.
Then let's show the audience, Henry, how is it that a herniated disc can become so painful for somebody? You know, we were once taught back pain, nobody knows where it comes from. But now we know where it comes from. And we know how often it comes from each of those places. So how is it that the disc, which is the number one cause of back pain, injured discs like herniated discs, bulging discs, how do they cause back pain? What's the mechanism? What happens to make a disc painful?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see the tear right here at 12 o'clock. There's what's called an annular tear, which is the annulus is torn, and the nucleus pulposus or herniation moves up into that tear, gets stuck in there, and your body is trying to get rid of it by attacking it with this process called inflammation, where your cells come in and start to release enzymes called proteases, lipases, sucrases, to just basically break down whatever it is that's there. Now, this system of inflammation is very old. It's been around for a long time. Since the beginning of human creation, basically, we call it the inflammatory system. And it's a system of cells that float around in your bloodstream, like macrophage, fibroblast, polymorphonucleocytes or PMLs, polymorpholymphocytes, and mast cells. These cells, well, remember, cells are the things in your body that actually do the work, right? It's our, for example, thinking is done by nerve cells. Hold the tube. Thinking is done by nerve cells. And contracting or movement is done by muscle cells, right? So you got muscle cells that do movement. You got brain cells called neurons that do thinking, and electrical relays are all done by the nerves. And this patient can appreciate that. He is an electrician himself. And then you got these cells that basically are part of your attack system, your defense system. All right, you got two types of defense systems besides your skin. I'm not going to count the skin, or the, epithelial lining of your intestine. I'm just going to count the systems that are designed for warfare in your body, your defense system. You have the inflammatory system and you have the immunological system. Those are two systems, and they have different cells that are their soldiers, right? So what's an army without the soldiers, the equipment? You need soldiers and equipment, right? You need more than that, but you need soldiers and equipment. Well, the soldiers in your inflammatory system are your mast cells, fibroblasts, polymorphonucleocytes, macrophage, and your tools, the weapons, are called enzymes. 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 The enzymes are these microscopic little proteins that catalyze reactions, changes, things. Okay? So along comes your polymorphonucleoside, which is filled with vacuoles in the cytoplasm that are filled with proteases, lipases, sucrases, right? And they show up and they just barrage everything in that area of inflammation with chemicals to try to destroy. It's like literally chemical warfare. Okay? Chemical warfare. So it's an old defense system that uses chemical warfare against enemies of your body. Now, it doesn't have a brain to think. It just uses the oldest type of signals called chemical signals, right? So it uses chemical warfare, but it also uses chemical signals. The signals that your inflammatory system uses are called cytokines. Cytokines. And they're ways for cells to talk to each other. Cytokines. Such as interleukins, growth factors, things like that. And when you get a tear in the back of your disc with a herniation, your inflammatory system gets activated by your endothelial system and mast cells in the tissue, and they say, hey, we got a problem here, we got a foreign invader. So they call in the inflammatory system. The inflammatory system gets hailed on the highway by the endothelial cells that make the blood vessels leaky right where the inflammation is. And all these cells that are floating around in your blood system, in your blood, get recruited over to the endothelium of your capillaries that are now leaky because your inflammatory mast cells made them leaky so that they would allow the humoral cells, such as polymorphonucleocytes, to marginate and cross the endothelial membrane and enter the tissue where the inflammation is happening, which is right here. You guys are looking at it right there. So all this is happening at a microscopic level. You can't see it with your eyes. You can't even see it with the endoscope that we're using. So all this is happening on a microscopic level. Any questions?
Yes, we got a question from Michael on YouTube.
Yeah, Mike.
Saying,
Welcome.
hi, Dr. Deuk.
Hey there, buddy.
I just put the popcorn down. Seeing outside the disc is fascinating, and I know you do the inside-out technique.
Yes, I do it. That's right.
Does disc pain come from inside the disc, and herniation is leg pain?
Yeah, that's a great point. Great point. So, look, the nerve fibers are right here. You guys are looking on the outside of the disc right now, okay? I'm just outside the disc. There's some epidural fat at 12 o'clock, a little vein bleeding. But basically, and let me see if I can get a better picture here. Yeah. So sometimes I can put in my grabber. It stops the little bit of bleeding, put some back pressure. All right, you guys are looking outside the disc. Right there at the top at like 12 o'clock, there are those white fibers that are just underneath the epidural space. That's the outside of the disc. That's where the pain nerves are. They start there, but they can actually grow on down this tear, right? With years and years of back pain and inflammation, they will grow into your disc. So to answer your question, the back pain, yes, it normally comes from the outside of the disc, the outer half of your annulus where you have these sensory fibers. But as the inflammation goes on and on for years and years, that area of pain gets bigger because the inflammatory tissue grows into, I'll do it one more, into the disc itself. And that's why I have to go all the way down the full thickness of the tear. As far as leg pain goes, leg pain, believe it or not, comes from the same thing back pain comes from, inflammation. But instead of being inside the annulus that causes back pain, the inflammation is inside the, getting on the nerve root right outside the outside of the disc. So the inflammation with all those, remember the chemical warfare? It leaks from the disc annulus where it causes back pain out to the nerve root where it causes what's called radiculitis. Radiculitis is not ridiculous. What is that show, the old show? Ridiculousness? Yeah, radiculitis is not ridiculousness. I used to like that show, by the way, but they had too many commercials. Radiculitis just means inflammation of the nerve root itself. It's usually inflammation of the dura, or covering. So the disc annular inflammation causes back pain. Then it leaks out. Those chemicals leak out next to the back of the disc to the nerve root nearby in the back of the disc, that nerve root there, the sensory ganglion, dorsal root ganglion. And it irritates that dorsal root ganglion, causes leg pain, sciatica. So that's how herniations cause leg pain. It's not from compression. See, all these doctors are so confused and wrong. They think that a herniation pinches the nerve and causes leg pain. It doesn't. It's the irritation of the nerve, dural covering, inflammation of the covering that causes sciatica. It's the pressure on the nerve that causes weakness, like drop foot or numbness in the dermatome or reflex changes. Yeah, so pain is always due to inflammation, whether it's disc inflammation, annulitis, or whether it's nerve root inflammation, radiculitis. All right, any other questions?
No current questions.
Thanks for joining us. I think we're done till after Christmas, right? No surgery next week? Nope. All right. Well, thanks for joining us. And Henry will show you guys one more patient testimonial, and have a happy holidays, whether you're Christian, Muslim, Jewish, or Buddhist or Hindu. It doesn't matter. Hope you have a wonderful time with your family and friends. And good morning, I'm Dr. Deuk Machen. 30 years of back pain.
Yes,
gone overnight.
Yeah, overnight gone. It was amazing. I've been dealing with it, suffering. If it wasn't for my faith and belief and my friends back home that supported me, my wife, I finally got here to the Deuk Spine Institute, and what an amazing experience it's been. Had surgery yesterday. I'm up walking around. I feel great. My pain was usually from a 6 to a 10 out of 1, if that. And I'm just so grateful that there are gentlemen in this world that really care about people like Dr. Deuk, and I can't thank him enough. I recommend this gentleman to anyone who's been suffering and doesn't know where to go for help. I live in the state of Idaho. It's a great place to live, but probably one of the worst states to get hurt in.
Well, we are happy you're here in Florida to get your back fixed. And we did the Deuk laser disc repair on your back and the Deuk plasma rhizotomy on your facet joints. And you had a fusion done before, is that correct?
That is correct.
And we saw in your video when we were doing your laser surgery, you could see all the screws and rods, and you even have a broken screw at L5 on the left side, I believe. How do you feel comparing your fusion surgery with the Deuk laser disc repair?
There is no comparison. 100% different. The fusion didn't help me, made me worse. It gave me a heart complication that I still deal with, but since I've been here, the people are outstanding in this facility, and I can't praise them enough. And Dr. Deuk is truly a godsend for people that are suffering. I can say 100% honesty that I feel totally different person. I'm just so glad that I came here.
How's your wife feel about your new back?
She loves it because she knows I've been dealing with pain and depression. It's a hard thing to deal with. It almost took my life, but like I said, with my belief in our Father and His Son Jesus has kept me here.
Amen.
And she's a big part of that. I got to thank my friends like Dave Bowden, Dan Arnold, and Brad Russell. Those are truly my childhood friends that never gave up on me. People judge me on how I look, not how I am. And I'm a very compassionate person like yourself, and I want to help other people. I can't suggest Dr. Deuk and his team here are world-renowned, outstanding, and everyone's so kind. I'm just so happy, to have you on my side, and I can't thank you enough. Thank you, sir.
Praise God.
Amen.
And thank you for having faith in my team and our ability to help you.
Yeah, it is. It's they're, like I said, they're world-class people here. You can't go wrong. At least for myself, I'm just ecstatic. It's can't put it into words when you have no pain. I love it, and I'm just so glad that everyone helped me who was involved with me getting here, because I didn't do it on my own. I thank you all.
Well, thank you for sharing your story. I know it means a lot to people out there. We just want people to know that we can now fix back pain, neck pain. They just have to come here to Deuk Spine and get the right treatment done, and we'll help them tremendously. Enjoy your travels home.
Yep.
And enjoy your new back.
And I shall. Thank you so much.
Yes, sir. It's my pleasure. All right.